Hi everyone, it's Dr. Hall and we're going to go through the blood vessels of the extremities in this video. So I'm going to do a little wonky cinematography so I can point out to you this structure on the models, this very superficial vein in the anterior medial thigh. This is called the great saphenous vein, and this vein is draining blood from all the way down at your ankle. It's very superficial. It's then going to drain into a deeper vein called the femoral vein. We can also see the femoral artery here. Those are deep structures. So on this side of the model over here, we can see a deeper dissection. We can see that femoral vein and femoral artery. Same thing on the other model. Here's the femoral artery. This is a deeper dissection. They've removed some of the anterior musculature. Both the rectus femoris and sartorius have been removed, and we can see the femoral artery and the femoral vein starting right there. The other thing that I want to show you on these models with a close-up is for the upper extremity, we also have a very superficial vein. So for the lower extremity, great saphenous vein is a very superficial vein. For the upper extremity, one of the superficial veins is this one right here. That is the cephalic vein. You can see it in this groove between the deltoid and the pectoralis major muscles. That is the cephalic vein. The other thing I want to point out to you before we move on is how that cephalic vein comes in. It's going to drain deep into the subclavian vein here, which then, once it collects blood from the internal jugular vein, becomes the brachiocephalic vein, which then empties into the superior vena cava. Reminder, our aortic arch, we've got the brachiocephalic trunk, left common carotid, and left subclavian. And the left subclavian is then going to travel out toward the upper extremity. So now we're going to look at the upper extremity. So I'm going to zoom out so I can show that to you. Okay. So in the upper extremity, when the subclavian artery comes out into the armpit area here, we change its name. We call it the axillary artery. It's really the same artery, but it's in a new location. It's moved out into the axillary area, the armpit area, so it's the axillary artery. As it travels into the arm, we change its name again to the brachial artery. These are accompanied by veins, also named the same way, axillary and brachial veins, just not on this model. As the brachial artery continues distally, it's going to bifurcate when it comes into the forearm, sending off the radial artery on the radial or thumb side. This is that artery that you feel when you feel the pulse in your wrist, and the ulnar artery along the ulnar side, right, along the pinky side. The radial and the ulnar arteries are also accompanied by veins. So we mentioned the cephalic vein earlier. There is another superficial vein in the upper extremity. So if the cephalic vein runs here, right along here would be the basilic vein. And those two are joined in the crook of your elbow by a little crossing vein called the median cubital vein. That's the vein where they normally draw blood from you if you have to get a blood test. Median cubital vein. Let's take a look at the lower extremity. So you'll recall that our aorta bifurcated into the two common iliac arteries, which then sent off an internal iliac down into the pelvis and an external iliac that headed out toward the lower extremity. So similar to how the subclavian changes name, the external iliac artery, when it gets into the lower extremity, we call it the femoral artery. So the femoral artery then continues down distally and moves toward the posterior aspect of the knee to what's called the popliteal fossa. So now we call it the popliteal artery, right here in the back of the knee. That is then going to send off an artery that travels along the posterior leg or the posterior surface of the tibia. So it's called the posterior tibial artery, and also sends an artery that travels along the anterior surface of the tibia called the anterior tibial artery. Thank goodness for names that make sense. Now these arteries are also accompanied by veins, so we also have an anterior tibial vein and a posterior tibial vein that drain into the popliteal vein that then comes up and drains into the femoral vein, which will then drain into the external iliac vein common iliac vein, inferior vena cava, back to the heart. And that's it for the extremities.